report myself. Okay. I did the work on identification and analysis of risk factor associated with loss to follow-up from tuberculosis treatment in Sanatorium Hospital in Luanda. Luanda is the capital of Angola. Actually, we are working to publicate these papers. There may be 2 or 3 papers, but I'll try to see if I'm going to work with the professor who presented before us, because there are some things that I find very relevant. Okay. Moving on slide. Tuberculosis continues to be a public health concern due to the higher prevalence, incidence, and mortality rate caused annually. In 2021 to 2022, approximately 10 million new TB cases were reported, with 1.5 million of deaths around of the world. And the concern of COVID-19 is affected on increasing, and also it affected on the notification, because some people, they were affected, but they could not be reported due to the COVID. And the mortality increased also. TB, as many of us we know, is an infection disease caused by Mycobacteria tuberculosis. As a professor, I was speaking to one of the colleagues. Per year, I attend more than 20, 35 conferences. And in one of the conferences, I asked him just randomly to find out the knowledge of tuberculosis to the people who attended the conference, which caused a TB. One medical doctor said, oh, TB is a virus disease. And it was a shock for me. It was very shock. And once I asked him, which is causing the syphilis, someone said, oh, it's a viral also disease. It's a shock. It's the reason that I'm trying to share this background about the TB concern definition. As we can see the picture, we have what we call in physiology phenomenon of hematose, which consists by coming in the oxygen and going out the dioxide of carbon. It happens in alveolus. That means what's happened when someone starts dropping the nuclear valve to the mouth or nasal passage to the respiratory tract, eventually reach the alveoli of the lung. Okay. There are many factors that influence the transmission of tuberculosis, but I highlighted 3 factors. First, which is sustainability, infectiousness, and environmental exposure. For the first one, the low CD4, the low immunity that a person is presenting is a risk to be infected with tuberculosis. Also, the quantity of Mycobacteria that someone is pulling out. We are in this conference room. If someone has a tuberculosis, as I said, we receive oxygen and we pull out the dioxide of carbon. Those dioxide which is going out, if it's contaminated, the quantity, it can also influence the TB transmission. What we can see, this is the picture of my country, Angola. As you can see on the photograph, there are houses with the window facing to a neighbor's house. This is a big issue for public health. As you can see, that means the tuberculosis can come from one house and immigrate to someone or to the neighbor, because the window is faced to each other. The dogs is faced to each other. Is a public health concern. And also the agglomeration of people in the market, as you can see on the picture, people are together, selling and buying is one of the factors that influence to the transmission of tuberculosis. Someone wanna say, how about in the UK? I was coming from home on the underground, I see the way that we were. Imagine, I was thinking, if someone is affected with TB, also the transmission is going to be easy. Part of that, we found out also people who live with HIV, children under 5 years, and those who they are receiving some immunosuppress therapy are a vulnerable group to be affected with tuberculosis. Okay, according to the diagnosis, we can use the AFB smell test. We use the Mycobacteria culture, and we can also use the GenExpert to detect the tuberculosis. Regarding the treatment, tuberculosis is a curable disease. There are specific drugs that we use to treat a tuberculosis. The treatment is based on 6 months. From the first 2 months, we use 4 drugs, such as isoniazid, ethambutol, and pyrazinamide. And in the 4 months, following the 4 months, we use just 3 drugs, which is rifampicillin and isoniazid. Regarding the epidemiology of tuberculosis, as you can see the sign here, in the 3rd country with the high prevalence, my country, Angola, is there. And I saw also online there is one colleague from Congo. The Congo is also there. China also is there. But what called me attention, not only the susceptible TB, but even the MDI, which is the multi-drug resistance, and the co-infection between tuberculosis and HIV. This is called our attention for Africa. Okay, now, our main topic is to find or to identify the factors that influence people to follow up tuberculosis. Regarding literature review, we saw some social demographic factors, such as age, gender, distance between the health center to the residence where people live, also cultures and ethnicity, religion, belief, and traditional doctors as Kimbandas. They are some socio-demographic factors that influence people to follow up tuberculosis. You can ask me, Professor Vita, how the culture can affect people? How the religion? I don't know in your country, but in my country, there are some pastors who preach, okay, you have this disease, I will pray for you, come to me, to my church, to my religion, God is gonna heal you from the disease. And as people, they obey the leaders on the communities, on the cultures, they will stop the treatment and following those beliefs. We find also the lack of community support, lack of information. Many people are not educated enough regarding the TB. I did a research asking people, do you know how tuberculosis is affecting people? Do you know what tuberculosis is? Many people, they answer no, they don't have any clue. This called me attention as a research. Level of education, unemployment, treatment-related factors, and the stigma is factors associated to the loss to follow up, as literature review revealed. And here we can see those factors interligated one to another. Okay, now, when people, they lost to follow up tuberculosis, the matter becomes more worse. One, patients are at risk of greater risk developing drug-resistant tuberculosis. And also, most of them, they result to death and increase the treatment cost. It is important to be aware loss to follow up tuberculosis is very dangerous matter. Once here in London, I was called as a scientist because a Somalian girl came to one of the unities. He never had tuberculosis. He never lived with people with tuberculosis. But when they tested the multi-resistant drug, he became resistant to isoniazid and rifampicillin. The concern is us. If he never been affected with tuberculosis, but why he's affected is showing, is presenting the resistance. When we identified, we found out the type of bacteria that he affected the heart, he was contaminated with MDR, which is multi-drug resistant. What does it mean? If someone he had already the resistance to any drug, and you catch that kind of vaccine, automatically you will be presenting also resistance. Okay, we are on with the time. The objective or the aim is just to identify and to analyze the risk of loss to follow up. As is a study, we had a methodology. Firstly, we get any approval to conduct the study in Angola. The study happened in Luanda with 130 participating. This is the description of the Sanatorium hospital where we did our study. We had the inclusion patient with 30 years old, patient who started the treatment, patient who signed a consent form. Okay. Here we can see our variables that we use it. On this study, I combine two studies, one quantitative and one qualitative. Okay, I'm reaching with the time. Now, as we can see our result of the study, the male people regarding gender, they predominated with 59.3. People who used to live in suburban area, because we was trying to find out if those variables, there are any correlation with loss to follow up. Okay. When we did X squared in SPS to try to find out if our variable, they have any significant association with loss to follow up. What we identify, the gender male, they have a significant correlation with loss to follow up. You can ask me, Professor, one, regarding our study, men in Angola, they are more vulnerable. Men, they work more than women. Men, they are more exposed. Those hard work in Angola, who does those work, they are men compared to women. And as we can see, the value of P or the P value works significantly. When we look at about the distance where people live, if it can be a factor of loss to follow up, we could not find any significant association with the loss to or with loss to follow up. This may be due to the less number or low number of people who participated to our study. Because trying to look very well, people who live maybe 2-3 hours from the hospital and they don't have money, they don't work, sometimes they are not able to go to collect the medication. it should come as another studies revealing that is a factor of loss to follow up. But in our study, we could not find it. Another factor that we found, it was the number of meals. Those people who eat 3 times per day, that means breakfast, lunch, and dinner, they were able to cure compared to those people who ate just 1 meal a day. That means eating 3 times per day, you have more chance of curing tuberculosis. But those who eat just once, they have, or there is a correlation between loss to follow up. I don't know if you are understanding. Good. May I continue? We are in conference. Conference is conferring. If you are not happy, you can say, Professor, I'm not happy. I will try to explain it properly. Okay. I'm the first one in the world, I'm so sorry to say that, when I did my PhD, it was one of the good point and hard point which gave me a distinction of my PhD. As we can see, God can heal tuberculosis. Those people who answered in my study, they believe that God can heal tuberculosis. When they attended the treatment, all of them, they got healed. But those who didn't answer, most of them, they lost to follow up. I proved that I'm the first one regarding to the tribunal when I did my PhD to presenting this kind of result. How can you say if there is a contradiction between believing or religion people who lost to follow up more and those who believe to God? There are 2 things. Someone can believe to God, but without of listening or without of loss to follow up TB treatment. Because he knows that who gives the wisdom to the doctor is a God. He knows that if doctor is telling me to take the medicine in the morning and in evening, I have to follow, to obey what doctor is explaining to me. This is what we found out. And those people who they obey, because being a truly Christian, I'm saying properly, truly Christian, you will believe to God and also you will believe to your doctors. And those people, they were cured, as we can see. We could not find any correlation between type of patient, symptoms of tuberculosis, between of diagnosis to the loss to follow up. But we found out those people who they came in TB severity in admission, they were more to loss to follow up compared to those who came normally. What you're gonna ask me here? You will say, Doctor, Professor, it's more easy someone when it comes in good condition to loss to follow up. No. In Africa, some people, they come really in worst condition. They are even died already. What I will say, okay, the patient is not well, he died. But the family, they're gonna say, no, give me a chance to take him to another hospital. From there, this patient is considered as lost to follow up because I did not give the death certificate to certify that person, he died. And I don't know where they went, what happened. This is one of the points that our study also revealed. Okay. We could not find any association between the toxicity when we did a squared or when we used the SPS to find out if there is any association. We could not find anything regarding the toxicity. But in multivariable analysis, as we know, we predict in the regression, we found out strongly eating less than 3 times, and severe TB is associated with loss to follow up. This is in qualitative analysis. But I was not happy because the result of qualitative analysis, we found just 4 points which was associated with loss to follow up. Then I went to the field work for 1 year more to conduct a qualitative analysis. I interviewed 49 participants on interview, and I had 20 for focus group. In my focus group, I worked with parents of children, family member, health professional, and the health professional. I had 2 groups. Okay, what we found out? We found out that health barriers, drug-related problem, and the symptom improve, and the social demographic are factors associated with loss to follow-up. As you can see, lack of access to the healthcare coverage. What does it mean? We had 1% or 1 family person and 2% revealing that, Professor, to have access to the healthcare is a big issue. Sometimes you reach to the emergency department to attend you, you can stay even 2, 3, 4, 5 hours. Is the reason of loss to follow up. But none of health professionals revealed something here. We found out also on lack of proper communication. 6 people stated that they lost to follow up TB treatment due to the lack of communication. Sometimes you call your doctor, you call a person who can receive you in the reception, he doesn't give you a good answer. He said, come tomorrow, we cancel your consultation. People, they become frustrated and they lost to follow up TB treatment. 8 people stated that behavior of healthcare provider. I don't know in your country how the healthcare behave, but in my country where we conducted the study is one of the issues. Medical doctor, when they wear stethoscope, sometimes they think, okay, we are a God. Instead of remembering what the soul as a hypocrite said about medicine, they forgot all those issues. It became bad behavior. We have drug-related problems like adverse event, which is the toxicity I said. When someone starts drug treatment with tuberculosis, he can start vomiting. He can start feeling dizzy. And what people said, okay, I was fine without taking medicine. Since I start taking the medicine, I'm coming worse. What happened? They give up due to drug related. This is the reason physician on this room, physician in the conference, we need to be careful about drug or the drug adverse event. Also, TB is one of the diseases that it takes long treatment. For 6 months, every single day, people take pills and pills and pills. It's not easy. We found it as one of the issues. There is a short issue here. One person said, I lost to follow-up TB treatment because one day they give me expired medication. Expired medication. That means the medication was over time. We could not use it, and they give me. And I found out that doctor who did that, he said, okay, the only result or the only possibility I had to give that medication because on stock, we could not find any medicine. And the person, he could not have money to afford the medicine. It was a shock, but this is what happened. And another issue that leads people to loss to follow-up TB treatment is a symptom improvement. As we know, when someone with tuberculosis starts treatment on first week, second week, it will stop sometimes coughing. It will stop presenting the clinical manifestation that he had before. And many people think, oh, yes, I'm fine. The prayer that my pastor made is working. I don't need any more medicine. Stop. Then the situation becomes worse and worse. Religion, belief, lack of family support, but as you can see, the big number was 29 from economic factors. People, they don't have food, they don't have transport to go to the hospital, they don't have money to buy a medication. And if you see in the yellow, 7 health professionals stated that, 4 parents, they stated that, 8 families, they stated that, patient experience stated that, and 90% they stated that. If there are members of government watching me, following us on this conference, we need to act, especially in Africa, to put more money to control and prevent tuberculosis. Okay. We found out what happened when someone gives up or lost up a TB treatment. 24 people said that people died. 49 people stated that the symptom returned worse. The symptom returned worse. That means we need to take care and seriously about the TB problem. We need to raise awareness in our community, especially to the patients who are affected with tuberculosis, trying to demonstrate to them as soon as you stop the treatment, the symptom will return worse. Now, what would any recommend to improve the TB treatment? This is the statement it came from our patient and the health professional. Point number 1, we had the improvement of communication between healthcare and the professional and the patient. That means what? Professionals of health who work in unity that they treat tuberculosis, they must improve the communication if we want to improve the situation. And also 22 participants stated that the education about tuberculosis. Give money to Professor Domingos Vita to go to educate people in the rural area about tuberculosis. It's not a thing. If you have a connection about some funding, because people are dying with tuberculosis without of knowing what is tuberculosis. It's a big issue. Not just in Africa, because tuberculosis is a pandemic. It's all the world. Improving practitioner attitude is one of the points also. Patient tracking and supervision. We need to employ more people who they can start helping patients to take a medication to supervise if they are doing well or not. 21 people stated that we need to improve the nutrition condition and economical support. What does it mean? Providing meals to people, because when we did a quantitative analysis, we found that people who eat less than 3 times, they are more likely to lose to follow-up TB treatment. That means if we provide more food, we help the situation of food, we're gonna help people to stay on the treatment. I remember when I went to the Sanatorium hospital, one of the patients told me, "Doctor, you know why first time I lost to follow-up tuberculosis? Because all the time they give me rice, rice, rice. And what happened? When we eat rice, rice, all day we start coughing, 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 coughing because of the rice." Yeah, I said, okay, that's fine. Maybe one day we need to take that to the MPs and to the government people who take decisions. Now, in our conclusion, in the cohort of patients who started first line of TB regime, the Sanatorium Hospital in Luanda, the proportion of loss to follow-up, it was high, with 24%. A severe TB presentation at moment of diagnosis of significantly associated with loss to follow-up TB. Eating less than 3 times per day or significantly associated with loss to follow-up TB. The main cause that loss to follow-up TB from patient and family members and healthcare providers, respective where it were healthcare barrier, drug-related problem, religion, socio-demographic variable. The many solutions suggested that patient and TB patient family member healthcare provide improve of communication between healthcare and the professional, as I said so far. Now, be careful, or I will call your attention for this recommendation. What we need to do to improve the matter of tuberculosis in the world, not just in Africa. We need to implement population a screening program, reduce the time to consult people. Secondly, improve the adherence. People that can have the access to the unities. New technology like mobile phone, text message, personal digital assistance, appointment remember. It is very relevant. What does it mean? If we apply some software where people, it can, like the alarm can ring to his phone, but when the alarm rings, no someone is calling him, just to tell him, wake up and take the drug, take the medicine. Is it possible to do that? And also, design education program for the community. We can do big posters and TV programs. I don't know in your country, but in my country, Angola, most of program goes to the television, sometimes it's for dancing. Instead of planning health programs where we can raise awareness, it is fundamental. Instead of just calling people to dance, presenting beer, presenting party, no. We need to think about the health. Also, we need to involve society referents like religion leaders, traditional authority, and traditional health, and the follow-up TB treatment. You know, the religion people in the community, they have a power. And they lead big communities, 10,000, 25,000 people. When we involve those people to the control or prevention of tuberculosis, as they have a word in their community, we're gonna decrease the problem of loss to follow-up tuberculosis. And also explore social program to help family affected with tuberculosis. What does it mean? We can start providing a food, basic foods, basic plan of nutrition. Even we can support with some money. They are a group of scientists from Valdebro Hospital in Spain. They are doing great work in Benguela. Benguela is one of the regions in Angola. They have a unity that decreed tuberculosis. But what they did, they bought a land and they planted a lot of food. Instead of buying food, sometimes they cultivate the food and they get that food, they are giving to people who come to seek a treatment of tuberculosis. Look the great work they are doing. If we implement this kind of theory in our countries, we can minimize the situation of tuberculosis, especially the loss to follow up. Thank you very much for following us. I don't know if we have any question. I'm here, I came all the way from Angola to answer your question. Even those who are watching us from Zoom, you can ask your question. If I was you, firstly, I was supposed to clap my hand because I did a great job. Thank you very much. Yes. Sorry? Yes. Okay. When you don't eat, your immunity, it goes down. Your CD4 goes down. You are not strong enough. And when you take the pills of TB, it makes you more weak. You start feeling dizzy. You start presenting sometimes those signal and symptoms of toxicity. What you will decide to give up. You will say, okay, I don't have food to eat. If I take the drug, I will become more worse. It's better to do not take the TB drug because I don't have food. This is what's happened. This is the correlation. But when someone eats, is strong, you take the pill, sometimes you're not gonna feel the side effect of medication. For TB, yes, we have BCG, what we give when you are born. But getting the BCG vaccination, it doesn't mean you never ever gonna be infected with TB. You can be infected with TB, but the way that it will attack you is not gonna be the same with someone who never got vaccinated. More question, even online, I don't know, we're gonna be able to see someone online if they ask a question? From here or from the voice? Because they're gonna, I think they will just, what? Okay, chat, yes. Let me see. We can see them. If you have your question online, you can ask. Joseph, Sid, Accept, Allah Smith, Alex Want, Ali, Belin, Elsa, Elmit, Joshua Olivia, Lara Wilson, Lack Allen, Lorette, Lenovo, Asia, Said, Marit Mukoka from Congo. I don't know how is the situation there. Marit Mukoka, Maso George, Nick, Sonia, Estelle, Anna Rice, and they said when they eat rice, they start coughing. Elsa Grace, Elsa Victoria, I don't know, Elsa Victoria is, she's Angolan or not. Michelle, Professor Olivia, okay, anyway. Someone have a question? I think no one. Okay. Thank you very much for watching my presentation. I will come back later with another topic, which is going to bless you also. Thank you.
Professor Jason, would you please come forward and give the certificate to Professor Vita?